Abbreviations in pulmonology. Abbreviation. Meaning. Brief explanation.
COPD, chronic obstructive pulmonary disease.
COPD. Chronic obstructive pulmonary disease. A lung disease that makes it hard to breathe due to long-term airway and lung damage.
ARDS, acute respiratory distress syndrome.
ARDS. Acute respiratory distress syndrome. Severe lung condition causing low oxygen levels in the blood.
PFT, pulmonary function test.
PFT. Pulmonary function test. A test to measure how well the lungs work, including airflow and lung volume.
CXR, chest X-ray.
Chest X-ray. An imaging test to check the lungs and airways for problems like infections or tumors.
ENT, ear, nose, and throat, abbreviated as ENT.
Ear, nose, and throat. A medical specialty focusing on conditions of the ear, nose, throat, and related areas.
OSA, obstructive sleep apnea, abbreviated as OSA.
Obstructive sleep apnea. A sleep disorder where breathing stops and starts due to airway blockage.
TB, tuberculosis, abbreviated as TB.
TB. Tuberculosis. A contagious bacterial infection that mainly affects the lungs.
ABG, arterial blood gas, abbreviated as ABG.
Arterial blood gas. A test to measure oxygen and carbon dioxide levels in the blood.
CF, cystic fibrosis, abbreviated as CF.
CF. Cystic fibrosis. A genetic disease causing thick mucus buildup in the lungs and digestive system.
PE, pulmonary embolism, abbreviated as PE.
Pulmonary embolism. A blood clot blocking an artery in the lungs, causing breathing difficulties.
Forced vital capacity, abbreviated as FVC.
Forced vital capacity. The amount of air exhaled after taking a deep breath, measured in lung tests.
SOB, shortness of breath, abbreviated as SOB.
Shortness of breath. Difficulty breathing or feeling like you can't get enough air.
CT, computed tomography, abbreviated as CT.
Computed tomography. A detailed imaging test to examine the lungs and chest for abnormalities.
Forced expiratory volume in 1 second, abbreviated as FEV1.
Forced expiratory volume in 1 second. The amount of air exhaled in 1 second, used to diagnose lung conditions.
ET tube, endotracheal tube, abbreviated as ET tube.
ET tube, endotracheal tube. A tube inserted into the windpipe to help a patient breathe during surgery or emergencies.
ECMO, extracorporeal membrane oxygenation.
Extracorporeal membrane oxygenation. A machine that provides heart and lung support for patients with severe conditions.
CPR, cardiopulmonary resuscitation, abbreviated as CPR.
CPR, cardiopulmonary resuscitation. A life-saving procedure performed during cardiac or respiratory arrest.
O2, oxygen, abbreviated as O2.
Oxygen. Essential gas administered to patients with breathing difficulties.
FOB, fiber optic bronchoscopy, abbreviated as FOB.
Fiber optic bronchoscopy. A procedure using a thin, flexible scope to examine the airways and lungs.